Hi everyone, welcome to Sense of Balance Live. I'm Sunanpua from Sense of Balance, the acupuncturist. Now today is a new topic, right? The topic is about what are fibroids. What are fibroids? Right. So we're gonna discuss what are fibroids, and tomorrow we're gonna discuss what are the different types of fibroids. Then further on, each day we're gonna discuss a little bit of topic. So what causes fibroids, and who is at the risk for fibroids, and what are the symptoms of fibroids. We're going to do a little bit of topics every day for about probably 15 to half an hour. Then how are fibroids diagnosed? How to diagnose fibroid. Then how do you treat fibroids in Western medicine. Then another day we're going to talk about how do you treat fibroids in Chinese medicine and acupuncture. Well, probably a lot of you didn't know that acupuncture can actually treat fibroids. But if that is the case, what treatment, right? What treatment can help, right? Is it easy treatment, or how long would you expect that the fibroid will go on, and how can you tell that the acupuncture and Chinese medicine are effective for fibroid? So all this information are important to know of. If you're an acupuncturist, you want to know. And what else can your patient do at home with fibroids? And fibroid what can fibroid cause? Apart from bleeding a lot, heavy period, what are the things that fibroid can actually cause for? Right, so those are important. So if you are up in here, right, and watching this live video, hi Eric, please give me a thumbs up and say hello to me, and as well as share this live video. Right. If you're watching replay, please do the same. Leave a comment down there and say hello to me and give me a thumbs up and share this live video. Thank you very much. Well, now, fibroids are abnormal growth that develop in or on a woman's uterus. So fibroids grow inside of the uterus or outside on the uterus. Okay, so let's make it clear. Fibroid can go anywhere in your uterus, in or on top of it. Okay. If this is fibroid, it can go. No, this is uterus. It can go on the top and the outside, and go inside too. If this go in the outside, what happens is around the uterus there are other organs such as bladder or intestine. So as the fibroid grows, it may attach with the others organs. So it will attach between uterus and intestine, or uterus and bladder. Wow, they become another issues. Okay, they become another issues because it may compress the other organs as well and causing pain, causing bowel motion problem, constipation, it may, okay, if the fibroid is grow on the uterus. When it go in the uterus, what will it cause? It causes bleeding. Both of them may cause pain, severe pain. Okay, bleeding, heavy period, severe pain, right? And as a potential like a risk to cause infertility. It all depends where the position is and how many and how big are they. Okay. Now I want to let you know when it comes to symptoms, you know, they could cause no sign or symptoms at all. No signs or symptoms at all. Okay. But I want to tell you that what in our mind we may think of well, if the fibroid is very big, they definitely will have some signs and symptoms, right? No. The symptom and sign, which mean unstopping period, bleeding, or abdominal pain, it does not equally depending on how many fibroids you have. Like the more fibroid, you get more pain or bleeding, or the biggest the fibroids that you get, and you get more pain or more heavy period. It doesn't make sense at all. It doesn't depend on this way. Okay, it doesn't. I remember once the first fibroid case that I felt, I didn't actually treat it. I actually failed it. Okay, one of the patients came in for, I can't remember what condition was it. It was a pain condition, and I palpitate tummy. Then I said, wow, this is something very hard in here. It's a lump. It's so big. It's so easy, easy to feel it. Okay. And I asked her, do you have pain? No. Tenderness? No. Nothing at all. And I said, what about period? How's your period? Oh, it's normal. Every month on time for 5 days. I said, okay, and you better go to doctor and get a second opinion what is actually in it, because it may be, I don't know, I was suspect that something is not good. And she went to hospital and a GP and arranged a ultrasound, and it came out it's a fibroid, a big fibroid, about that big, bigger than a tennis ball. Obviously that has been for a long time. Then she just went for surgery, remove it. That's it. She actually ended up had a remove the uterus because I think that was it. But it's funny, I would just choose to remove that because they say, well, you have your son and you don't need the uterus. That is common. One of the most common reason to remove uterus is fibroids, because if fibroid is causing heavy period. So fibroids is a tumor. It's a tumor. Okay, but then when we talk about tumor, wow, everyone's gonna be scared about it. So you don't have to scare about this, because this type of tumor, fibroids, the growth are typically benign, and you put it that way. Yet non-cancerous. It's not a cancer. Okay, it's a very benign one. So it'll cause some problem, and the problem is abdominal pain. The symptom and the sign is actually abdominal pain. It may not have any sign. You may not have any sign, but if it's the sign, more common is abdominal pain and heavy period. Hi, happy day. When we say heavy period, while you have your period, you get heavy or unstopping. You get a period continuing a lot every day. You may not stop it, or it stop again. So you may heard a lot from here. Fibroids are also known by the following names: leiomyomas, or myomas, or uterine myomas, or fibromas. So those are the name that your doctor may tell you that instead of fibroids. They say, oh, you have suffered from myomas. You heard a lot about that, and they are actually the same thing. Okay, what happens? I have patients can say, oh, I suffer from leiomyomas, because the doctor told them that. I said, this is a fibroid. Or my doctor said it's leiomyomas. It seems like it's different. Fibroids, including leiomyomas, they are talking the same thing. So the patient didn't know that. They say, "Wow, it's the leiomyomas." I said, "Yes, it's fibroids." Something like that. Okay, so I have patient before lockdown, a few months ago, and she was bleeding for 3 months, about 3 months. Then I said, "What do you have a report in her skin?" And she gave me the skin, and they couldn't find anyone with that. They didn't know what's causing the bleeding for 3 months. She was very sick, And I looked at the report, the ultrasound report, and said, "Oh yeah, they couldn't find anything." But what was the reason? I said, "Well, if that is the one, it may be the functional issues. So let's try herbs." And we try herbs, and it stopped for a while, and it came back again. And then the other option for her is remove the uterus, which she didn't want to. And then we went to a lockdown time. Then she had another skin. It was good that she had another skin, and they actually found that she suffered from fibroids. Just a little one. You see, causing bleeding for 3 months, and she had a skin, couldn't see anything. And in second one, she had a little one. As soon as you remove the little one, gone. Stop the bleeding. That's why I say our patient have big one, no sign, no pain, no bleeding, and this patient only have little one bleeding for 3 months, heavily. So you never know what patients, whichever suffer from fibroids, who will have signs or who will not have any signs and symptoms. Now, according to the National Institute of Health, about up to 80% of women have fibroids by the age of 50. By the age of 50. Okay. Again, however, most women don't have any symptom and may never know they have fibroids. Okay. And a fibroid will stop grow, or it will shrink down once you finish your period, because fibroid is depending on the hormone. The hormone, the female hormone, when it produces more, it can stimulate to grow fast. Okay, there is some information that I want to give you. Fibroid can cause infertility. Okay, it's about 5 to 10% infertility patient. They suffer from fibroids. Okay, fibroids. It depends on the way the fibroids grow and how big they are. You know, not every of the fibroids actually causing infertility. You know, and then when it can cause infertility, and it can also cause miscarriage as well. Okay, those are the two things that you may need to worry about when you have a baby or you have a fibroid, and they have to often check that whether the fibroid is growing or not, because the hormone change definitely while you're pregnant. So when the baby grow, and the fibroid will grow too. But sometimes the baby grow, the fibroid is not grow, and that's great. But sometimes if the fibroids grow and the babies grow, you don't have enough space for the baby, and there's a potential to kill a baby, causing miscarriage or stillborn. Okay, so in this cases, you really need to check it regularly, and if the fibroid is in the way for the baby, with the pathway for baby to born, to pass out from the uterus, and that's another issues as well, and you may need cesareans. Okay, right. I think that is the information that I want to share with you today. Okay, now if you find interested, you find it helps a bit, you know, I add on some of my experience, and hopefully that help you, you know. Then when it comes to treatment, we can talk about how to treat it. Okay, how to treat it, and with Chinese herbs and acupuncture as well. Okay, stay awesome, and I love you all. I'll see you tomorrow. Bye bye.